Morning, everyone. On behalf of JSS Institute of Naturopathy and Yogic Science, I am honored to invite you all for this precious event. So today we are having health talk on Down syndrome. So the session is led by Dr. Shabita, Associate Professor and Senior Medical Officer. So herewith we are going to share some important news regarding the Down syndrome. Over to you, ma'am. Thank you.
Thank you, Dr. Chitrambaram. So today, March 21st, it is announced as a World Down Syndrome Day. This session is very important because the main motto or the aim of the session is to create a awareness about this Down syndrome and what are the treatments can be done, how to manage this Down syndrome people naturally, and of course, counseling kind of thing to the parents. This is what we'll be seeing in this session. Next. So this Down syndrome, people are born with extra chromosome. That's what it is said. It is a chromosomal disorder disease, or we can say it is a genetic modified disease. Usually we have 23 pairs of normal chromosomes. Okay, so in that 23, it is a single brand. So when it is chromosomal division, it has to be 46 chromosomes. So in a normal people, we do have 46 chromosomes, but in Down syndrome, there will be 47. So this is the reason why they have a different physical and mental differences. Next. Okay, so as I said, this Down syndrome is a genetic condition that occurs mild to a significant physical and the developmental problems. Physical in the sense bodily changes, as well as some intellectual delays also. There will be a problem in this Down syndrome. And this Down syndrome is named after a person or a doctor who's called as Down. His name is John Langdon Down, who's a doctor. He is the first person to describe this disease. We can say he described this condition at the year 1860. So the doctor's name is Langdon Down. Next. So this Down syndrome, it's a lifelong disease. That's not cure for disease. It is said as a congenital anomaly, which means during birth itself they have these conditions. So they have to live with this Down syndrome throughout the life. So it is a lifelong condition. If a child has this condition, so we have to take care the care should be in a very clear and proper management has to be given. So if proper management is done, then the kids with this Down syndrome will be having a meaningful life. Next. So as I said, this Down syndrome is a genetic disorder, usually with the physical traits. So people with these conditions are often social and friendly. So they wish to mingle with other peoples. They like their relatives. They like their friends, siblings, and all those things. So they will not detach from the family or the society. Socially, they are very friendly. Next. So autism and Down syndrome, there are differences. So autism is not Down syndrome, and Down syndrome peoples with Down syndrome may have this autism or may not have this autism also. So let's see the difference between what is autism and what is Down syndrome. So this autism, it's a spectrum disorder. It is a neurological disorder, but our Down syndrome is the genetic disorder, chromosomal disorder. Autism is a neurological disorder. Okay. this autistic children usually they prefer to stay alone and they will not like the socializing with the mingling with the other peoples. But Down syndrome is they're totally opposite from this autism children's. Okay, so but there are few similarities between these two groups, like they both autism and as well as the Down syndrome. They prefer what do you say, the routine in the day-to-day lifestyle will be there. They prefer routine lifestyle, and they both have the developmental delay milestones will be there. Both avoid the eye contact. They used to enjoy the repetitive plays and all these things. They do have the what do you say, behavioral challenges will be there in both the conditions, like autism as well as in the Down syndrome. Next. Okay, about 18% of the Down syndrome. Like, consider if there is 100 Down syndrome peoples are there. Among that 100 Down syndrome, 18 peoples will be having or may have a Down syndrome along with autism. Others may not have, may or may not have. Okay, so the study says that 18% of the Down syndrome peoples are having autism also along with Down syndrome. Next. So next is the types of Down syndrome. There are mainly 3 types, which is trisomy 21, translocation Down syndrome, and then mosaic Down syndrome. This trisomy 21. Next. So this is the common type what we are seeing in the cases of this Down syndrome. Here, it is a 95% of the people with Down syndrome are having this trisomy. Here, what happens is that the chromosome number 21, instead of 2 chromosomes, there will be 3. As I said earlier, you can see the round area in the image 21 area. 3 chromosomes is there. So when you count all these things, there should be 46. But in this what do you say, this chromosome study, that will be 47 chromosomes will be there on total. So this 21st area of the chromosome link or a pair, 21st area, instead of 2, there will be a 3 chromosomes. Trichromosomes will be there. That is why this disease is itself called as trisomy 21. The Down syndrome is also said as trisomy 21. Next. Translocation Down syndrome, 3% of the people are having this. Here there is a chromosomal change, but not the full chromosome will be present, but partially this genetical modifications will be there. So they may act as a carrier of this Down syndrome, but they may not have the symptoms as such. If this translocation gene persons can deliver a child, then that child may have the Down syndrome definitely. Next is the mosaic Down syndrome. It's the least one we can say. So in this type, it is said that the chromosomes are scattered, or you can say in a specific areas of the body, but not in full. See, in trisomy 21, this 21 chromosome, 3 karyotypes will be present in all the cells of the body, but in mosaic, some cells of the body will be there. So this type of Down syndrome, they will not show the all symptoms of Down syndrome. Okay, only few symptoms will be present. Next. So these are the typical features you can have. When you see a Down syndrome child, these are the typical features you can see, like, the eyes. They have a typical eye feature, which is called as mongoloid. The eyes of the Down syndrome peoples will be slightly slanted upward. Outer corner will be slanted slightly upward. That's a typical symptom. And then they have a small ear, flat nose, which means the the nasal bridge between the eyes, that area will be flat or sometimes it's absent, we can say. And the oral cavity, the mouth will be in a smaller size. So automatically the tongue will protrude out. And there are white round ball-like structures present in their eyes. And then the very typical symptom is the short neck, and the overall height will be less. Short stature, it is said. And then small hand and feet. These are the typical features. Next. So these are the typical features. As I said, the short stature will be there, and they will be having a weak muscles and loose joints because of the poor muscle power, you can say. And the pinky finger, the little finger will be mostly curved, it will be affected, we can say. And this is the one more typical symptom in the Down syndrome. The loss of palm or crease, second crease, only one crease will be present in the palm of the crease. Usually there will be more than one crease will be there. But here in Down syndrome, it is only one crease. Next. Yeah, in this image, it is very clear. You can see the eyes. The outer side is slightly slanted upwards. The nasal bridge is absent. The nose is blunt. Thin lips, upper lip is thin, you can see. The tongue is protruding out because the mouth oral cavity is in a smaller size comparatively. And there are a few other symptoms also. Next. See, here the first slide it shows very clearly. It is the image, and the next is the Down syndrome patient's image. Only one, in the second image, there is only one palmar crease is present. This is a typical symptom, and the fingers are very short. Next. So there is a huge gap between the first and the second toes. There will be a huge gap will be there. This is the typical symptom. The palm and the feet. Even the feet is also in a smaller size. Next. So in this image, you can see the short neck. See, there is no neck at all. The chest and the chin is almost in the same line. Short neck. The tongue is protruding out. The nasal bridge is lost. Next. Okay. This is also a typical symptom where you see the flat face and of course the flat occiput also. There will be an absence of this occipital protuberance. So the backside scalp will be very flat. In this image, the neck also, the height of the neck, you see, it is almost lost in this image. Next. Okay. So this says about the the developmental delay from the normal child when compared to this Down syndrome. The gross motors like, sitting or standing, crawling, and all these things are said to be as the milestones in a child's life. So this sitting alone without any support, it happens at around 6 to 30 months. But in normal children, it will be around 5 to 9 months. So crawling takes around 8 to 22 months. It will take around 2 years also, 1 to 3 years. But in a normal child, it will be less than 1.5 years. And the speech, when compared to the normal child, the speech of this Down syndrome, they talk word or spelling or the initiation of the speech will be after 1 year only. But in normal children also, it is after 1 year. So the typical thing is there is no much difficulty in learning or speaking for this Down syndrome. Next is this responsive smile, finger free, self-eating and all those things will be happening more or less same like a normal children. Okay, only the initial milestones like sitting, crawling, walking, standing will be taking little delay than compared to the normal child. Next. So these are the symptoms we can say. This Down syndrome, they may have the effects like, mental disabilities will be there. And most people with this Down syndrome may have mild to moderate issues with thinking, reasoning, and understanding. Thinking, reasoning, and understanding. So as we know, the Down syndrome peoples will be having less IQ when compared to the normal. So that is why they are facing these types of issues, we can say. And the people with Down syndrome may also have a trouble in behaviors. Behavior in the sense they they are very much willing to mingle with this socially. As I said, they are very social, they are very friendly, but they do have some hindrances in their behaviors, like the attention. They can't pay the 100% attention because their IQ is little less, so that is there. They're little obsessive with some things, whatever belongs in their lifestyle. And of course, they do have their, what you say, lack of control on their emotions or their impulses. These are the symptoms we can very easily see, and they get easily frustrated to even small things because they can't manage their anger issues and all those things. These are the behavioral symptoms as it's seen in the as the symptoms in the Down syndrome. Next. Okay, so as such, as a normal, how we spend, or a normal people's and a Down syndrome, they can have a same lifestyles. They can be independent. They can go out. Even if they are trained very well, they can have a normal life. That is what it says. And but they in Down syndrome, even they can have a normal lifestyles. They do have some, what you say, issues or some problems in making decisions on few things, like they need support from their guardian or a parents, you can say, in whatever the cases, like strong decision making, vital decision makings, or managing the money and all those things. The Down syndrome people may need help, but rather than that, doing the routine works, they can be trained and they can perform. They can have a normal lifestyle. There's no issues in it. There is no burden for the family if they are trained very well. So next is the causes of the Down syndrome. As I said, there is the 21 chromosome is 3. It has a 3 chromosomes, so total they have a 47. That is the main issue of this, main cause of this Down syndrome. As such, there is no, this is the only reason. It can be idiopathic, or the parents, if they are translocated genes, then the kids may have. Okay, so this is the main cause, is the only chromosomal. It's a congenital disease also. Next. Is Down syndrome hereditary? It's a big question. Is it hereditary? It is a genetic. It may not be hereditary. It can be hereditary also if the parents are translocated gene, and the kids will be having this 100%. They'll be having this what do you say, the Down syndrome. But there are few reasons, like next slide. Okay, that as I said, there is no exact cause for this Down syndrome. There are a few assumptions, or a few studies showed these types of reasons or causes, like women with the above the age 35 are higher in chance or risk factors to get this Down syndrome children. That's what they say. And the man above the age 40 and the women above the age 35, if they are having a baby, there are incidents for this Down syndrome is higher in rate. And women with less than 35 years age, so also having this Down syndrome babies. That could be the reason why maybe the mother may have addicted to alcohol, smoking, and all these habits. That could be the contraceptives, like regular contraceptives that may does some changes in their chromosomal divisions, and that could be the reason. These are the risk factors, we can say. Next. Next. Okay, previous. I couldn't see the heading properly. Okay, fine. So these are the Down syndrome test. So if this is to prevent the prevention of a Down syndrome, we can say we should have a clear knowledge about what is this Down syndrome, how to prevent or how to train. That's what the awareness about it now. Fine. So here the routine test during the pregnancy can be used to check the baby if it is affected, the chromosome is affected or not. So if it is in a risk, or if it is confirmed during the screening, then we can terminate that pregnancy, which we can avoid the delivery and the future sufferings. Okay, so in the prenatal genetic testing, in the screening, the mother's blood can be tested. First thing. Next. Okay, so screening, these are the screening tests we can say. The blood test, the DNA test, we can say, or the genetical test, and the any chemical mediators test can be done. Ultrasonography can be done. And then a few other techniques is also there, which are the confirmative tests. We'll see in this. This screening test, it doesn't tell the, the screening test is, as I said, ultrasonography and blood test doesn't confirm it, but we can have a doubt regarding it. But these are the confirmative tests. We can say this is the chorionic villus sampling, amniocentesis, and umbilical cord blood sampling. But these tests are little harm, or it may harm the growth of the child. So this has to be done at the last confirmative test. But before this confirmative test, there are certain tests which can give a screening, and there may be a chances. So those tests are next. So first diagnosis here is the physical examination. On seeing, as I said, the facial, eye, feet, palm arteries, and all those things, on seeing itself, we can come to a diagnosis that this baby is having a Down syndrome or not. The next is the chromosomal study, the DNA, the 21 chromosome, 21st place. We can see the whether it is a 3 or 2 chromosomes present in it, and a radiological study can confirm the diagnosis also. And there are some antenatal examinations, antenatal in the sense during pregnancy, checking the baby's blood. Amniocentesis is a procedure where the amniotic fluid is aspirated. Like, we have to pierce the amniotic sac, we have to suck the amniotic fluid, and that will be underwent for checking and all those things, which is a confirmative test for the Down syndrome. Next. So these are the complications. Complications in the sense the people with Down syndrome, as they have a physically issues like muscle, as I said, joint flaccidity will be there, lack of muscle strength or muscle power will be there, but they do have a really big health issues because of this 21 chromosomes. Okay, trisomy problem. These are the complications, mainly heart problem, congenital heart disease. They may have a atrioventricular septal defect, or a tetralogy of Fallot, and all these conditions may happen in this Down syndrome. And many people are having this, hearing and vision problem, and gastrointestinal issues are there. These are the conditions they have to undergo surgery. If it is a heart problem, valvular issues, then proper surgical remedies has to be done. And in gastrointestinal, if it is a celiac disease or any blockages in the small intestine, then it has to be removed surgically. And then they'll be having a weight issues. Congenital hypothyroidism is a major issue for them. They do have a neurological problems. For that, this is the main symptom is the seizures, fits, we'll say it as. And this Down syndrome may have breathing issues, sleep apnea, asthma, and pulmonary hypertension. This Down syndrome children are prone to get leukemia, which is called as blood cancer. Very 25% Down syndrome having this leukemia problem, and they do have an early onset of dementia, forgetting all those things. Their body will get aged very soon when compared to the normal people's. Aging of the body will be there. The total lifespan of the Down syndrome is maximum for 50 to 55, healthy lifestyle. And they are prone to get, most of the Down syndrome peoples are prone to get Alzheimer's disease. Next. So coming to the treatments, as we have to see the symptoms and what are the difficulties they have, accordingly we need to do the management. But the physiotherapy or the physical therapy, occupational therapy plays a major role in dealing with this or managing the conditions of this Down syndrome. And there is something called as behavioral counseling, which is given for the cognitions and the to learning the lifestyle, to do the routine works of their day-to-day life. This behavioral counseling also helps. Next. So in physiotherapy, what is the main aim? What it is planned is like, it includes the activities and the exercise to develop the motor skills. Motor skills is nothing but the muscle movement. As I said, their muscles will be, weak, and the joints will be flaccid. Their body will not be strong as a normal people's. They are very weak. So to increase the muscle strength and improve the postures and balancing, this physiotherapy helps a lot. And speech therapy is something to improve the communication skills. As such, they don't have much problems. But if they are trained very well by this speech therapist, then the effect of learning to speak is very easy. Next. Okay, next. Occupational therapy. Occupational therapy is the one which is done for the day-to-day activity training. How to take bath, how to brush, how to dress, how to make themselves hygiene, and all those training. This occupational therapist can guide very much for the Down syndrome than the others, and they do assist in the skill training. Each and every person have a different types of skills. So to identify the skill in that particular person and to to improve the skill of the persons, they'll give the training for that particular skills. Next. So these are the naturopathic managements we see. We can give aromatic massages for them to reduce the behavioral changes, to reduce the frustrations in them, to calm their neurological issues, or to calm their mind, to make happy, and all those things. This aromatic massage helps, and of course it helps in the muscle toning also. For the motor issues, this can be given, this aromatic massage can be given. And there is something called acupressure, which is very, very useful in the neurological conditions, and as well as in the muscle toning and all those things. We have to select few acupressure points, and strong pressure will be applied to that particular areas. That will give a nice circulations inside that body, which helps in the conditions. Next is the reflexology. Acupressure will be given in the foot as well as in the palms, where the nerve endings are present. That also has a major healing capacity in this Down syndrome. Makes them feels good actually. And there is a technique called yogic breathing techniques, which is called as a pranayama, we'll say. The proper techniques, if they learn, it is good for their lung problems, because most of the Down syndrome have the reduced immunity. This yogic breathing habits will boost their immunity in a desirable way. And hydrotherapy techniques, there are few baths, packs, which can make their muscle tone, or which can increase their muscle tone very nicely. And next is the chromotherapy, using colors to treat the symptomatic treatments. Of course, they are breathing, lung strengthening, immune boosting, and all those things to develop the defensive mechanisms in their body. So all these things, this chromotherapy helps a lot. So selecting particular colors and giving that colors as a treatment to that Down syndrome people. Next is the diet therapy. A balanced diet with high protein will be preferable to these types of disorders. Next. And there is something called as, in a treatment, there is something called as individualized education program, which means that one Down syndrome people will be attended individually by experts. This is not present here. It is in the European countries. They do follow here, which they find out the special skills about that and give the continuous training will be there. So with this training, the Down syndrome can have some education also. Next. Okay, so here in the topic Down syndrome support, this is a place where the family or the guardian of the Down syndrome has to be supported, which means they should build the family should build a support systems with their friends or a family to take care of that Down syndrome child. And what are the challenges they are facing to handle with this child. So have a discussion with the professional and take a guidance or a support from the professionals, and just start to implement it in your day-to-day lifestyle, which reduces the challenges or the stress in your lifestyle, especially the parents or the guardians of the these children's. Next. And the foremost important thing is the take care of your health, which means the parents, those who are taking care of this, you have to take care. Equally important as to take care of the Down syndrome, equally important we should give to the mental health as well as to the physical health of the parents. That is the main awareness we should create in this session. Exercise and eat well. Even when you feel burnt out, try to make a plan and stick to it. So just make a plan. What are the day-to-day activities? Exercise, have a healthy food. Just stick to that plan. Exactly. Okay, so as today is the March 21st awareness of the Down syndrome, World Down Syndrome Day. So this aim of the session is to give awareness about this. This disease can be prevented. This disease cannot be cured. So it can be prevented if at all, if they have they have a Down syndrome, this can be managed in a very easy way. There are a lot of techniques to do, and they can have a normal, healthy lifestyles like as the same as a normal people's. Okay, so have this awareness. Try to do the antenatal screening during pregnancies and try to avoid such types of deliveries. That is a foremost cause, or you say the aim of this session. There are a lot of screening techniques, as I said, first trimester, second trimester, and third trimester also. Okay, so try to take that awareness. Those who are pregnant or those who are planning for, go for this genetical studies, and then make sure to avoid the such type of deliveries. And if at all there is a baby is born, we can take care and we can give a normal lifestyle to these persons. So thank you.
Thank you, ma'am, for giving this wonderful knowledge, for sharing this wonderful knowledge. Your inputs and insight, it will validate it more. Thank you.